G'day, Dr. Tay. Today I want to talk about whole plant medicine. In the cannabis plant, there's a myriad of biologically active compounds. We've got our THC, we've got our CBD, but there's over 144 other cannabinoids that have been isolated. We also have terpenes, we also have flavonoids. So you can extract single molecules out of the plants. You can just have THC, you can just have CBD. But in my clinical practice and other people's clinical experience, when you do this, when you isolate the cannabinoids, the effect is not as good clinically. So whole plant medicine is best. And this is how we select our strains to select our ratios. So you might have heard the term ratios talked about before. 1:1, 2:1. This talks about the THC as the CBD ratio. And different diseases require different ratios of those two main cannabinoids. Rather than isolating the cannabinoids in the lab and then recombining just the THC and the CBD to how we want it, it's best to find those ratios within the plant. So you can also find these ratios by combining two or more plants, but I think it's not clinically effective to isolate those molecules out. So for instance, you might want to achieve a 1:1 ratio for your patient, meaning we want THC 1 part, CBD 1 part. But you might choose to take the THC from a THC high strain and take the CBD from a CBD high strain using the whole plant extract from both. So you're getting the benefit of all those other cannabinoids that'll be in there, all the other terpenes and all the other flavonoids. That's whole plant medicine. And that's related to what's known as the entourage effect. The entourage effect is the effect that the combination of the cannabinoids and other bioactive compounds in the plant of cannabis are greater than the sum of its parts. So all of those things work together synergistically to affect the way that THC and the endocannabinoids bind to our cannabinoid receptors in our body. The terpenes and the CBD and the other cannabinoids and flavonoids modulate how effective that binding is of the main cannabinoids in our body, anandamide 2-AG and THC. So, long story short, whole plant medicine is best. Thanks. I'm Dr. Tay.